My hip started hurting about a year and a half ago when I was training for a fitness competition. As a physique competitor in the bikini division, as of right now, I can barely lift weights with my legs. I have not been able to compete in my sport. It was extremely depressing for me. Jared is my fiance, and we're getting married. I'm concerned about my hip. I want to be able to dance with my new husband. I've seen several doctors, and none of them know what's wrong. I'm scared that my end result is to wind up with surgery. Today's the big day. The doctors have hooked me up with an orthopedic specialist, and I'm super excited and nervous.
Where's the pain?
It's in my right hip. It's more towards the middle.
Okay. How's that?
That pinches.
That's it right there, right?
Mm-hmm. It hurts all the time normally. It's either a dull ache or it's a shooting pain.
Anyone in your family have any hip problems?
Yes, my mom has had a hip replacement already, and then my younger sister just had hip surgery as well.
So, given what you've told me so far, I think I have an idea of what's going on, but I think we should definitely get x-rays of both sides and an MRI, okay? And that way we'll come up with a plan on how to fix this.
I'm really looking forward to finally finding some answers. I'm so frustrated, so I hope this is my last stop.
How are you doing, Stacy? You're okay?
I've done every x-ray and every medical imaging thing.
We're done. You did a great job.
Now I just have to wait for some answers. Keep your fingers crossed, it's just an injury.
Stacy joins us along with sports orthopedic surgeon Dr. Neil Ghodadra, and you have Stacy's MRI results. I know you wanted some answers, right?
Yes, I did.
So do we have any answers today?
We do. You do have a tear in something we call the labrum, okay? And you also have something we call hip dysplasia. And what that is, it's a hip malformation. It's as if the hip is a ball and socket joint, okay? And typically it has a nice roof to it. Okay. That's what we call the acetabulum. Well, in your case, what's happened is that roof has retracted back a little bit. So part of our roof is missing. And what happens is because you're so active, you're young, you're getting in, doing your exercises, the labrum, which is what's torn, is the cushion in that joint, okay? And you keep hitting that cushion repeatedly. And what happens is it tears. And when it tears like a hangnail. And just like a hangnail, if you're sitting around, not doing much, not hitting it, feels okay. Sometimes you hit it the wrong way, really hurts. And so we have a lot of options for you, okay? And I know your main goal is to get back to everything, right?
Yes.
Get back to fun, being young. I have a way that we can get you there, okay? And what it would require is repairing that labrum, almost gluing that hangnail back down.
So surgery?
Okay? It's a type of surgery, yes. But good news is it's hip arthroscopy, meaning it's minimally invasive, outpatient, same day, takes 45 minutes, you go home. If you don't want to go the surgery route, we have other options to at least give you temporary pain relief. We have something called PRP and something called stem cells. PRP is called platelet-rich plasma, okay? PRP for short, obviously. Okay. But the beauty of it is that we take your own blood, okay? We spin it. We take the platelets, which I consider the good stuff. It's got all the growth factors and it's anti-inflammatory. So what we do is we take that in a very, very high concentration, okay? Almost 10 to 1 of what the normal blood has. Okay. And we inject that back in. The idea behind it is that when you do a heavy concentration of it, it goes to the site of the tear, and not only does it release growth factors to help it heal, regenerative factors, but it also recruits stem cells to that area. And stem cells are the coolest cells of the body, okay? They can do almost anything. And so the idea is if you can recruit that there, whether there's a little bit of cartilage damage, whether there's a little bit of labral damage, like the hangnail we mentioned, sometimes, okay, not all the time, it can provide enough pain relief for the patient that you feel great. It's like putting a little numbing medicine on that hangnail. All of a sudden, you have the hangnail, but guess what? You hit it repeatedly, it's not gonna bother you.
One of the cool things I think that you're really highlighting is that there are multiple treatments, and at the end of the day, you gotta figure out what's comfortable for you, but there's a little surprise for you that, that Dr. Ghodadra has offered to take care of this for you for free, and we wanna thank you for offering that. Hey, I'm Dr. Travis Stork. Press here to subscribe to the doctor's YouTube channel and press here to help reduce tension.